all for being here today on short notice. I really appreciate it. The city appreciates it. I just want to introduce us all really briefly. From the city, we have Chief Graziano, Chief Lucas, Pat Sheridan from Business Administration, Jessica Eskra from our legal department. City Controller John Murray is here. Representing City Council, we have Councilperson Kyle Donahue here. From the St. Patrick's Day Parade Committee, we're honored to have Ray Linnedy, the Executive Director, and Tim Holmes from Public Relations. We're also joined by Jason Kavulich, Director of Lackawanna County Area Agency on Aging. From the medical community, we have Dr. Shubhra Shetty, Infectious Disease Specialist at Geisinger Commonwealth Medical College. We have Dr. Shrikant Hosier, Chief Medical Officer from Geisinger Community Medical Center. From Commonwealth Health of Scranton, we have CEO Michael Brown and Dr. Pat Conavoy, Chief Medical Officer. So we're grateful as well to the business community. We have Bob Durkin, President of the Chamber of Commerce, and Leslie Collins from Scranton Tomorrow, representing downtown businesses here. So thank you all for being here on short notice. We wanted to show, we've all been on the phone throughout the last many days. And first and foremost, we're grateful to the parade committee for being proactive in its decision to postpone the parade. It is not a decision that they took lightly, not one that any of us took lightly, but we really are appreciative of them. So I wanted to bring up Tim Holmes first to speak to that.
Thank you, Mayor. In light of developments with the spread of the COVID-19 virus here in the East Coast, and mindful of other recent cancellations of parades in Philadelphia, Boston, and Ireland, the St. Patrick's Parade Association of Lackawanna County has decided to postpone the 2020 parade. As conversations continue with officials from the city of Scranton, all agree that the safety and well-being of our community is of primary concern. Scranton's parade is one of the largest in the country and draws scores of visitors from far and wide, and we simply want to avoid exposing our community to the additional risk with having a huge event like this in our town. While the decision is disappointing, we are acting with the general concern of everyone in mind. In the coming weeks, we pray that the COVID-19 virus will run its course, and when we are confident all is clear, we will enthusiastically plan a new 2020 date for the St. Patrick's Parade here in downtown Scranton. Stay tuned.
Thank you, Tim. So in addition to staying in communication with the parade committee about COVID-19's possible impact on the parade, my team at the city and I have been working since Monday morning, especially setting up a command center in my office to proactively be working with community partners, stakeholders, healthcare providers, educational institutions, state health officials, national healthcare professionals, and other cities' emergency coordinators, and those in our business community, many of whom are here today. It's important to note from a public safety perspective that mass gatherings have a potential to spread the virus throughout the community. There are no cases that we are aware of in Lackawanna County right now, but as we all know, those infected with COVID-19 can show zero symptoms and still be highly contagious. I want to reiterate that common sense really applies here. If you feel sick, stay home, and we encourage residents to follow CDC guidelines and recommendations. Acting Fire Chief Lucas, our emergency coordinator, will continue to provide updates regarding COVID-19 as the city has been doing. The parade committee made a prudent and sound decision to postpone, and the city supports the committee and its decision. We know that many are disappointed, as are we, but we continue to work together to figure out at some point when we can reschedule. We'll continue to monitor the situation and keep the public informed. As we talked about, it's paramount that we protect the health, safety, and well-being of the residents of Scranton, and that's why we're all here. I will now introduce Chief Graziano, Chief of Police, to speak to police presence on Saturday.
Thank you, Mayor. Good afternoon. So from a police perspective, we certainly support the parade committee's decision when any type of celebration and public safety conflict, public safety needs to win 100% of the time, so we support that. As far as operations go, we will still have a heavy police presence out for the 24 hours around where the parade would have been because of the anticipated other events that will be taking place within the city. There will be no parking restrictions, there will be no road closures as there would for the parade, but the rest of operations for the police department will continue. We will still have the same zero tolerance for any type of criminal activity within the city. With with a much heavier police presence, even though the parade isn't going on.
Thank you, Chief. And Jason Kavulich, Director of Lackawanna County Area Agency on Aging. Thank you, Jason.
Good afternoon, everyone. On behalf of the Area Agency on Aging in Lackawanna County, I just want to thank the mayor for highlighting how important it is for us to keep communication open about the older adults in our community. The older adults in our community are perhaps the most vulnerable population to what we're facing today. And I want to make sure that everyone knows the lines of communication are open with Harrisburg. We're getting instructions weekly, if not daily, as for precautions that we have to take in our office. And we're making sure that the lines of communication are open both with the city and surrounding communities, and making sure that the older adults in our community have a direct line of communication with us as well in case their needs rise to a level that we need to intervene. So for all of the folks involved in this process, we're extremely grateful. And on behalf of the older adults in our community, I want to thank all of you for having us here today. Thank you.
Thank you. Dr. Hosier, if you could come speak for Geisinger and the medical community, that'd be great.
Thank you, Maya. And as you know, Geisinger has been serving this community very proudly for the past 6 odd years. And I'm very happy to introduce my team here. We can field any questions. We've been preparing for this virus for a few weeks, and we can take any questions. We are very prepared and very proud to serve the community and keep them safe through these tough times. I have Stephanie Grabowski, who is actually our head of emergency preparedness, Dr. Dabadell, who's an infectious control director at GCMC, and Margie Pace, who is the quality director at Geisinger Community Medical Center, and we have our infectious disease expert from our college, Dr. Shubhra Shally.
Thank you. And Dr. Conavoy, thank you.
Again, I just want to thank you for looking forward and thinking about public safety over the next weekend, because we had spent a lot of time planning and thinking about how we were going to handle what happened over the weekend. Again, our team, just like Geisinger, has been working with the CDC, the World Health Organization, and our corporate office to develop plans going forward. We've had meetings on a daily basis, and hopefully our planning won't be needed, but if it is, I believe we're ready. Thank you.
Thank you. And to speak to the economic impact, Pat Sheridan from my team, if you could say a couple words, and then I know Leslie from Scranton tomorrow had a statement she wanted to read.
Thank you. Good afternoon. We're certainly a bit aware of the impact that a cancellation or postponement of the parade is going to have on the business community. And what we will do is work very closely with the parade committee in taking a look at when it would be rescheduled and work to recreate the event in the same manner that it would be should it be held this weekend. But the city is very cognizant of the impact that this delay will have on the business community. Thank you.
Good afternoon. In the light of the Parade Committee's decision to postpone Saturday's events, Scranton tomorrow extends our full support to the Parade Committee, as well as the City of Scranton, and most certainly to our downtown business community. We understand that this certainly was a difficult decision to make, and we are in uncharted territory. So Scranton tomorrow is prepared to engage our community partners, our economic development partners, in promoting our downtown business district in creative ways to make sure that we can sustain our economic viability. And we are hopeful that all of our businesses certainly will be very open to that option, and we will abide by safety regulations. Thank you.
Okay, thank you, Leslie. And the foundation of all of this, of course, this isn't just about the parade. While it's, as we've spoken about, and I had the honor of being able to attend the dinner for the parade committee on Sunday, and it's a disappointment to all of us in terms of the culture. This is such a cultural and economic event for the city every year. But everyone standing here today, this is far beyond that. This is about the health, safety, and welfare of our residents, and this is an ongoing, obviously an ongoing situation. And I hope that this show of force here tonight, we are all in touch in the local area to be able to serve the residents as best as possible as we go into what hopefully is not, but could be a tough couple of weeks, hopefully not months. So thank you all for being here, and thank you all for standing up here with us today and being in such great communication throughout this time. So we're happy to take questions from anyone.
Can we hear from the Geisinger infectious disease expert?
Absolutely. Yes.
Go ahead.
Yes, sir.
Given that there is no, by the way, would you say who you are and spell your name, please?
Sure. I'm Pragya Dobadel. I'm an infectious diseases physician and a director of infection prevention for Geisinger.
Would you spell your name, please?
Pragya, first name. Last name is Dhaubhadel.
Okay, great. Given that there are there's only one case even in proximity to Lackawanna County, what is the efficacy of this? Why is this necessary? I think a lot of businesses are going to take a big hit, and they're concerned about that.
So as we see that the COVID-19 disease is spreading across the world, and we see more and more cases each day in the United States as well, and it is transmitted in the community as well. So we have to be aware and make sure our community, public are safe. So if we take precautions and avoid gatherings which involve close contact, we can eliminate the chances of transmission and keep our community safety.
Even though there's not a case around here yet?
Even though there's a case not over here, this is a big parade, and there will be people all over the country. So the risk definitely remains there.
Okay.
This is my question. You can postpone the parade, but what if the people show up anyway? And the parade is merely a feature of the event. It's the high holy day of drinking in Scranton. That's what it is. I mean, you may still end up with a vast number of people coming to the downtown anyway. I don't know if you're in touch with the businesses, but they're going to be open, obviously. So I mean, you may have a parade without the parade. Are is that something you're planning for or thinking about?
Carnival's
The chief.
Well, certainly, yes, that our plans are moving forward. We're preparing for that. But in the end, there will be less people here. So I'm certainly not a physician to speak on that end, but the less people you have, the less chance that there could be some type of transmission. So, but from a police perspective, our operations are continuing full steam ahead.
So does that mean you're operating as if there is a parade?
Absent the road closures and absent the staging of the actual officers in the parade route, yes. The rest of...
Same number of officers or fewer?
We don't speak to numbers of officers, but we will still have a heavy police presence in the city of Scranton for 24 hours.
And just to follow up on that, we have been in touch with many of our, more active local bars and restaurants that do indeed intend to be open. We've also invited them to exercise caution about how they're going to promote that we're going ahead anyways, because, they do also run the risk of, so they should probably be putting out the same statements we put out a couple days ago about taking precautions, wearing gloves, being careful, shaking hands, and all the other stuff that would happen. But families around the community, these there are families that have 60-year traditions of gathering and all their family coming into town, which is wonderful. It's a great celebration of those traditions. But if they do it within the safety of their homes or within the restaurants that they traditionally go to, I think they just need to exercise caution and just be aware that people are coming from all over the eastern seaboard to come to our town, and it's a real thing. So it's part of our concern with exactly why we did this.
Is there any sort of is there any sort of deadline for actually deciding we're not going to have a parade this year? At some point, when you get to the summer, maybe.
Well, there's a few things in terms of what we've discussed. Our first thing is going to be watching the course of COVID-19. But obviously you then get into other events that happen around the city. There's an armed services parade. You know, we're not going to conflict with anything that already exists. But we know of many, many communities who have halfway to St. Patrick's Day events in September. So everything is kind of on the table, but yeah, that's very likely, you know, if we get to a certain point, yeah, we'll discuss it at that
Is there a
point.
point? What is that point? Is it summer?
Let's say halfway to St. Patrick's Day. No, but I would say we would certainly want to do it within, the next few months. And just speaking to the economic benefit to all the places around town, it's a great day and it's a great celebration, and it's something an awful lot of towns our size would love to have an event like that draws folks from all over. So I think we'll have no problem getting this done.
Can you foresee not having one?
Can I foresee that?
Yeah.
I can't foresee that.
Are you ready?
I can't even imagine that.
No one wants to foresee that. Have you made any attempt to sort of gauge or put a number on the economic impact, or what it may end up costing?
I don't know, Bob Dorkin, have we ever put a number on that? Our chamber is here, but it's
We're talking about something that hasn't happened. So
Right.
well, just what happens every year. It's really hard to put a finger on it.
Do you
Yeah.
know what the economic impact is each year? Well, how much revenue does the parade generate?
Our Visitors Bureau would likely have numbers on that because the hotels and unless you have some ideas, but it's huge. It's a huge.
You come from Ireland for this parade.
We most certainly do. We have bands coming from all over. We have 12,000 people marching in this parade. Like it's not overinflated. There's a lot of people who come to this, so all of that brings impact. And so I think that would really be it. But the Visitors Bureau, I would bet, would have some stats on that, and we'll talk to them to get that.
Can we speak to the Geisinger?
Just one second. Chief Lucas wanted to speak to, Boris, your question about the local businesses.
Yeah, just to address the question on reaching out to the businesses, but that we'll still have a crowd coming if they would. Part of our job as emergency management is to be putting information out to all of the partners in the city. We've been doing that on a regular basis, and what we planned on doing for this event was we're going to hit all of the downtown areas that are known to have congregations of people, and we're going to give them flyers and information that we're going to ask them to post in their bathrooms and front doors, reminding people to keep social distancing of 6 feet and, washing your hands and so forth. So that's all going to happen and was going to happen, and even with the postponement and in anticipation of the crowds, we are going to address that way.
Social distancing is tough, though. Fall.
It would be, but education and just if we just keep pushing that message, we're hoping that people will heed that message.
Thank you.
Are you guys advising anyone to stay home if they do and not participate in any drinking events, if they are feeling ill?
So you took the words out of my mouth. I would say people should act responsibly. If you're sick, stay home. There will be another parade, maybe this year, maybe not. But I think it is very, very important. If you're sick, if you're high risk, if you've traveled to an area where there's a lot of COVID-19 activity, please stay home. You may not get terribly sick with it, but you may make somebody else really sick. And if somebody takes it home to somebody who's immunocompromised or elderly, they can die of this infection. So just to act responsibly and be sensible about it without, getting paranoid. I guess that's the best advice I can give.
Can you say your name for me?
Oh, my name's Shubhra Shetty. I'm an infectious disease specialist, and I work at the Geisinger Commonwealth School of Medicine.
Can you spell that for us?
Last name is Shetty, Shetty. Shubhra, Shubhra.
I'm sorry, I wanted to ask, so in terms of preparedness, how is Geisinger set for? Do you have the beds you might need, or do you have the testing? There's been a shortage of testing, and that's been a big national, we're talking about that nationally a lot. Like, how does that work? Are you guys ready for, I guess, the worst case scenario?
So the good news is that right now, we're not seeing a lot of patients in this area, so we're not doing a lot of testing. But any patients that are meeting the criteria for screening, we are completing those testings.
So you have the tests?
We have the tests through the CDC. We've always had them. All hospitals have the ability to test a patient and then send that patient's specimen to the CDC for confirmation. Geisinger is working to have their tests up and ready soon. We're not exactly sure how long that will take. Could be a week, it could be 2 weeks. But when that's available, then we have to reevaluate the screening that we have in place. We still want to make sure that the appropriate people are getting screened.
I have a question for you. So we've gotten some calls to our office. If you're at home and you feel sick and your symptoms match, what should you do? Should you go right down, or should
No,
you?
you should call the Geisinger hotline. So if you go on to geisinger.org/coronavirus, we have a hotline that's available 24/7, and it is for Geisinger employees to reach the different services that they need, whether it be lab specimens, infectious disease doctors, but it's also for our patients to call in. They'll speak to a nurse on the phone, and then depending on the types of symptoms that they have, we would either send them to the appropriate medical facility for testing, if appropriate. Mm-hmm. Did that answer your question? Yes. Yep. Thank you.
I think it's important to remember I think it's important to remember that there's still influenza activity, so there is some overlap in symptoms. So there's influenza activity, there's the common cold, there are other respiratory viruses around also. So not everything is going to be COVID-19. And, like was said, there are some facilities in place. I think the testing capacity will increase in the next two weeks or so, I anticipate. So to make use of that, the hotlines, the available sources, and to not panic.
What is that number? Did I hear? The hotline number?
Phone number.
Actually, Pennsylvania has, might be a little easier to set up if you call 877 PA Health. That's the Pennsylvania Department of Health. They will direct you to the right person who will screen you to see if you are eligible for testing and help get that done for you. So 877 PA Health will get you what you need.
Yep. So the Geisinger hotline number, probably the difference between the Department of Health number is we're calling the Department of Health number as well when we need testing to be verified. So if you call 570-284-3657, that's going to give you those options. It's going to get you in touch with a Geisinger physician. It's going to get you in touch specifically with a Geisinger nurse triage, our nurse triage hotline, and then they'll get you to the appropriate facility. They'll ask you a bunch of questions about exposure. They're going to be reading directly from the CDC exposure and screening checklist, and then if you're appropriate for testing, they'll send you to the emergency department most likely, until we have other testing centers available in the community.
Is there any kind of special training going on with any of the nurses, for instance? They're the frontline people.
Mm-hmm. So the really neat thing at Geisinger, actually, that we haven't highlighted a lot, is that Geisinger has been training for highly infectious disease for, probably since really the Ebola outbreak many years ago, since 2014. So we have a lot of specialists at Geisinger that we're actually deploying to all of our sites. So if we have patients that are what we call persons under investigation, we're suspicious that possibly it could be a patient, we're deploying those people and helping out the staff in our urgent care centers and our emergency rooms to deal with those patients.
Do you have any?
Have any?
People suspected of having the virus right now?
No.
Are you at full staff right now?
Yes. Yes.
Okay. If there are no other questions, I think I'll just echo Dr. Shetty. You can get someone else sick, which is a consideration. It's not just if you yourself feel symptoms. If you have someone at home who fits the criteria of being susceptible, either a chronic health condition or older adults, realize that if you go out, you can get them sick when you come home. So that's another consideration. So again, thank you to all of you. The city and everyone up here continues to be in touch and monitor the COVID-19 situation, and hopefully we won't have to have too many of these, but we stand ready to do that and communicate with the community and you all here. So thank you.